talk about this. Thousands of students are heading back to school once again. We've had a number last week, more this week, and even more today. And parents have their hands full to get them ready, not just with the school supplies, but that includes your child's health and well-being, which is just as important. So we're joined by Dr. Day, who's not only a doctor, she's a mom. She's sharing some very practical things she does in her own home to prepare her kids to go back to the classroom. So first of all, introduce yourself and which hospital you're with. You're with Village Medical.
Village Medical.
Great,
yes.
Great organization. Oh my gosh, it's a great hospital.
I'm Dr. Christy Heatley. I'm the Senior Medical Director with Village Medical. And yes, I am also a mom.
You're like, well, first she's a mom,
yes.
Then she's a doctor, then she's with Village Medical.
Yes.
So first of all, thanks for being here.
Absolutely. Thanks for having me.
Of course, because there's some parents out there who are really overwhelmed.
Yes.
They're excited for their kids,
Absolutely.
but they're overwhelmed, and they need some help. They need to be ready. And I use that word because you have an acronym that goes with all of this to explain what they need to. As a mom, what is it like for you? Because how many children do you have?
I have two.
Okay, what are their ages, if you don't mind?
Well, at this point, they're 18 and 22, but I've gone through all of the stages. So.
Yay! So
Getting
you
them
know
back
what
to school,
to do.
I know what to do, yes.
All right, so let's break it down because there is a process that every single family has to go through based on what their child's needs are.
Right.
But there are things that you can help them with. So we need to get ready. So let's talk about that. What is this acronym we're talking about and how is it going to benefit people?
It's actually an easy way to remember the basics before getting ready for school.
Okay.
R stands for routine, E is for emotional health,
Yeah.
A is for appointments, D is for digital boundaries, and Y is for you matter too.
I love the way that's broken down, and it's also very simplistic, which makes it easy. Let's talk about R, the routine.
R, routine. The most important thing I think really is sleep. Getting back into that sleep pattern before school starts and gradually setting those wake times and sleep times before school starts. Now we're already getting into the school starting, so it's a little late now, but that's super important because our kids, our teenagers need 8 to 10 hours of sleep. Our elementary school kids need 9 to 12. So sleep's important for attention, learning, physical health.
Can I add something to that? And it's not just the kids who need to be getting sleep, it's the parents who need to get sleep, right?
Right.
What was it like for you when your kids weren't sleeping? It messed up your schedule
Absolutely, and that's where our why comes in.
Okay, we're going to
matter too.
We got to go in order because I'm going to get myself confused. So, okay, so routine. Let's talk about that. We just did that. So let's go to the next word. The letter, rather, is E, and you say emotional health.
Emotional health. You know, it's normal to have nerves going back to school, and our kids will have anxiety. And you know, I tell my families in practice to ask our children what's making them anxious. And kind of give them permission to tell us what they're nervous about and hone in on that anxiety. And, you know, as a physician, I definitely want them to look for those harmful behaviors like withdrawal and frequent stomach aches and headaches and irritability and things that would make you need to take your child to their healthcare provider.
That's so true. All right, what's the next letter?
The next letter is appointments. So it's super important. This is the time of year to follow up with your healthcare provider to talk about your annual wellness.
Oh, that's so important.
You know, and preventative care and hearing and vision checks, because sometimes attention and learning disorders are actually really trouble seeing and trouble hearing.
They are, and you've got D and Y, so let's start with D real quick, because we got about a minute and a half.
Digital boundaries.
Oh, put those phones down,
kids. Put the phone down an hour before bedtime and charge the phone outside the room. Phones need a bedtime too. And then Y, of course, is you matter too. As a parent, you've got to take care of yourself, and you've got to model that healthy behavior.
So that's why when you brought up Y earlier, it's like that's what model the behavior, which means you need to get the sleep. You need to be taking care of your emotional health and also listening to your kids, creating communication. You
100%.
need to be doing those same things as well, because as a parent, if you don't have it together, it makes it even harder for the child to do it as well. Okay, so where can we get help on these resources? If we want to contact you or Village Medical, how can we go about doing that?
VillageMedical.com, very easy to remember.
Okay, well, any last piece of advice now that you're past that age of elementary, middle, and high school?
Just don't aim for perfection, aim for consistency. Kids thrive on predictability.
Yeah, no one's perfect. You will make mistakes. Forgive yourself and help your kids along the way, right?
Yes.
Well, you were incredible. Dr. Heatley, thank you so much.
Thank you for having me.
Appreciate it. Of course, of course.